This patient was referred to me for endodontic treatment of tooth number 12. You can see crown here. Looks like a large recurrent decay on the distal. So I discussed options with the patient. I told the patient this tooth may not be salvageable. So I recommended that the patient went back to his dentist and have his dentist cut that crown off, clean out the decay, inspect the tooth, and see if there is any tooth left. If there is enough tooth left for the dentist to build it up and put a new crown on it, then told the patient, schedule an appointment with me, come back and I'll do the root canal for you. Otherwise, your dentist will extract the tooth for you. So patient agreed. Patient came in today for the root canal, okay? And that's the tooth now, has a temporary crown on it. One of those material that you can't see, you can't pick up on an x-ray. So patient said he went to his dentist. His dentist cut the old crown off, cleaned out the decay, and said, yes, this tooth I can save. So go ahead and schedule an appointment with the endodontist, me, and come back in. Patient says the dentist was putting the temporary crown on the tooth, cementing the temporary crown on the tooth. She dropped the temporary crown. And as she dropped the temporary crown, and patient, of course, is breathing, patient inhaled the temporary crown. It went down his trachea into his lung. Can you believe it? That's why I say use a rubber dam. Use a freaking rubber dam. Patient says for half an hour he was coughing and trying to see if he can dislodge it by coughing. When that didn't happen, he went to the emergency room. And went to the emergency room. They kept him overnight, and they had to scope him, put a scope down his throat, and finally they were able to, with a scope, non-surgically, they sedated him then, and they were able to remove that temporary crown from his lung. Can you believe it? Use a rubber dam. Use a rubber dam. If dentist had used the rubber dam, if he dropped it, the rubber dam would not have allowed the temporary crown to go down poor patient's throat. So patient says he went through a terrible couple of days, and he's so glad, he's so happy that it finally worked out. But he went through so much, and God knows what his bill will be, the medical bill will be, because chances are that his insurance company will cover some of it. He'll have a copay. I don't know. Hopefully he's got good insurance. His copay is not that much, but use a rubber dam. And here is our post-op. So went through the temporary crown, put a rubber dam on. Of course, no rubber dam, no root canal. Put a rubber dam on. Went through the temporary crown, and as you can see, 2 canal systems. Everything went well. 25 millimeters, 26 millimeters. Buccal was 25, palatal was 26. Everything went great. Temporized the tooth and referred the patient back to his dentist. Hopefully now his dentist will put a rubber dam on.